This is part two of the endocrine system. We continue talking about endocrine glands with the thyroid gland. The thyroid gland is a bilobed gland that lives in the anterior aspect of the neck. It lies just anterior to the trachea, just inferior to the larynx. It produces three hormones. The first two, thyroxine or T3 and thyroxine or T4 and triiodothyronine T3, those are switched on my slide, have one function, and then the second hormone, calcitonin, has a different function that has nothing to do with the first two. This is an example of the thyroid gland in the neck. Here's the thyroid cartilage of the larynx. The cricoid cartilage is here, and here's the thyroid gland. It has two lobes connected anteriorly by what's called an isthmus. If you look at the thyroid gland microscopically, what you see is roundish fluid-filled structures called thyroid follicles. These thyroid follicles are made up of follicle cells, and those follicle cells produce colloid. Colloid is an inactive version of the thyroid hormones T3 and T4 that when the thyroid is stimulated to release thyroid hormone, the colloid is taken back into the follicle cells, converted into thyroid hormone, and then emptied into the capillaries between the thyroid follicles and into the bloodstream. In addition, in between the thyroid follicles are what are called extrafollicular cells. These extrafollicular cells are cells that produce a separate hormone, calcitonin, that we'll talk about in a few minutes. Thyroid hormones themselves consist of two. Thyroxine, or T4, is called T4 because it has 4 iodine molecules in it. Thyroid, or triiodothyronine, is called T3 because there are 3 iodine molecules in it. Iodine is necessary for the production of these hormones, and it's the only area in the body where iodine is an essential element. There are no other places in the body that iodine is used, the element, except in the production of thyroid hormone. The thyroid follicle cells, when stimulated by thyroid stimulating hormone from the anterior pituitary gland, take the colloid, which is an inactive form, into the cell and then convert it into thyroid hormone, T3 and T4, and then empty it into the bloodstream. What do T3 and T4 do? Well, T4, or thyroxine, and T3 have similar effects, although T3 is 5 times more potent than T4. Both thyroid hormones have the ability to increase energy release from carbohydrates. What does that mean? That means breaking down complex carbohydrates like glucose to produce energy. Think of thyroid hormones as being similar to the throttle in your engine. If you increase the throttle of your engine burns more fuel, uses more energy, and that's what thyroid hormones do. They also increase the rate of synthesis of proteins and accelerating growth. So thyroid hormone works with growth hormone to increase and accelerate growth. It's also important, especially early in life, in the stimulation and activity and development of the nervous system. Several conditions related to abnormal thyroid are very common. Hyperthyroid means an overactive production of thyroid hormones. There's 2 major causes of it. First is the most common is what's called Graves' disease, where you have antibodies against the thyroid that actually bind to the TSH receptors, fooling the thyroid follicles into releasing more thyroid hormone than they normally would. This is an autoimmune disease, very similar to other autoimmune diseases like rheumatoid arthritis, type 1 diabetes, and so forth. It is actually your body's own immune system attacking your body's cells. People with hyperthyroidism do have an increased metabolic rate. What does that cause? Well, it causes an increased heat production, which means it causes fever, it causes hyperactivity, it causes tachycardia. Because you're burning carbohydrates, it causes weight loss. It causes a protrusion of the eyes called exophthalmos, and it can cause a production of a swelling in the neck called a goiter. The other process involving the thyroid is hypothyroidism. Hypothyroidism means underactivated thyroid. Underactivated thyroid also has a common autoimmune cause called Hashimoto's disease, where antibodies actually attack the thyroid follicle cells, so they do not release thyroid follicle, resulting in hypothyroidism. Because the thyroid is very, very important in development of and function of the nervous system, all babies when they're born, before they go home from the hospital, are tested for thyroid hormone. If they are lacking in thyroid hormone, they are given thyroid hormone supplements, because if they are not, then their nervous system will not develop appropriately, and they will end up with a condition called cretinism, which is shown here, where you have stunted growth because the thyroid hormone affects growth, but more importantly, because it affects the nervous system, you end up with severe mental retardation, low body temperatures, and so forth. If these children are identified at birth as having low thyroid and you replace their thyroid hormone, they will have absolutely normal growth. Adults can also develop hypothyroidism for many different reasons, Hashimoto's disease being one of them. Ultimately, if hypothyroidism is severe in adults, it can cause a condition called myxedema. Myxedema is a life-threatening condition of low thyroid production in adults that leads to very, very low metabolic rate. These people have increased sensitivity to cold, their body temperatures are low, they're sluggish, their heart rates are low, they can have mental dullness, and they can have development of swelling of the tissues that are consistent with what's called myxedema of the body's tissues due to the low thyroid production. The other hormone that's produced in the thyroid that has nothing to do with the thyroid hormones is calcitonin. Calcitonin is produced by those extrafollicular cells outside the thyroid follicles, and it's produced in response to high blood calcium levels. And basically what calcitonin does is, when the thyroid extrafollicular cells identify high calcium levels in the blood, they produce calcitonin. And calcitonin works in 3 ways to lower blood calcium levels. First of all, calcitonin works in the intestines by decreasing absorption. So the foods you eat that have calcium in it, the calcium is not absorbed, therefore your calcium levels do not go up from that. In addition, calcitonin affects the bone. It causes deposition of bone. Remember, bone matrix consists of calcium, and as you lay down more bone, you're laying down more bone matrix, and you're taking calcium out of the circulation and laying it down in bone, and therefore decreasing your calcium level. The third thing that the calcitonin affects is the calcitonin basically tells the kidneys that they are not to reabsorb excess calcium in the tubules. Therefore, there's more calcium excreted in the urine, which again drives down the calcium level. So if your calcium level is high, the extrafollicular cells produce calcitonin, which works to decrease calcium absorption in the intestine, increase bone deposition, taking calcium out of the blood and laying it down in bone matrix, and increasing calcium release from the kidneys in the urine. All of those things then will bring your calcium level back down to normal. The parathyroid glands are the glands that do the opposite of what calcitonin does. The parathyroid glands are usually 4 small glands that sit on the posterior aspect of the thyroid gland. They secrete one hormone, parathyroid hormone. If calcitonin is produced in response to high calcium levels and it lowers calcium, parathyroid hormone responds to low calcium levels and raises calcium. Here's a diagram showing this is the thyroid gland seen from posterior, where you have the pharynx and the esophagus. This is the posterior aspect of the thyroid gland, and these are your 4 small parathyroid glands. These parathyroid glands watch the blood as it flows through and look for calcium levels that are low. And if calcium levels are low, they then secrete parathyroid hormone to raise the calcium levels up. How do they do that? The same 3 ways that calcitonin brings down calcium levels, parathyroid hormone brings them up. So if your blood calcium level is low, your parathyroid glands are going to secrete parathyroid hormone into your bloodstream, which affects the same 3 systems of the body. It tells the bones to actually break down bone matrix. When you break down bone matrix, you release calcium into the bloodstream, which drives it back up. In addition, the presence of low calcium levels secretes parathyroid hormone that affects the kidneys in 2 ways. The first way it affects the kidneys is it tells the kidneys, want you to reabsorb calcium because our calcium level is low and not lose it in the urine. So calcium is not excreted in the urine. The second thing the kidneys do is when parathyroid hormone is present, they activate vitamin D, which then causes an increased calcium reabsorption in the intestines. All 3 of these things then raise your calcium level back up to normal, and once it's up to normal, negative feedback turns this off. This is a diagram of exactly how parathyroid hormone works to stimulate the increased absorption of calcium, the activation of vitamin D. Vitamin D can be ingested and taken from certain foods, broken down by intestinal enzymes into a provitamin D, which then passes through the skin, and ultraviolet light from the skin causes this provitamin D to change into a substance called cholecalciferol, which is another inactive precursor of vitamin D. You can also ingest this vitamin D in the foods you eat. But this is not completely active yet until it passes through the liver and a hydroxyl group is added, and then due to stimulation from the kidneys in the presence of parathyroid hormone, that is converted into the active form of vitamin D, which is dihydroxy 2-OH groups, cholecalciferol. And this activated form of vitamin D causes the intestines to increase calcium reabsorption in the foods you eat to raise your calcium levels up. So calcitonin and parathyroid hormone act the opposite of one another to maintain a stable blood calcium level. If your blood calcium level starts to go up, the thyroid gland is going to release calcitonin, which is going to bring the calcium levels back down. If your calcium level in your blood starts to go low, the parathyroid glands are going to recognize that. They're going to produce parathyroid hormone, which is bringing your blood calcium levels back up. Why is it important to keep your blood calcium level stable? Because if your blood calcium level gets out of range, gets abnormally high or abnormally low, it can cause severe problems in the body. Hypocalcemia is abnormally low calcium, and you can see the problems you can have, including some life-threatening problems like seizures, like heart failure, if your calcium level gets low. If your calcium level gets too high, hypercalcemia, that also can cause severe problems. Heart arrhythmias, it can cause severe low heart rates, muscle weaknesses, confusion, coma, and death. So calcium levels have to be maintained at a very tightly controlled level, because too high is bad, too low is bad, and the presence of calcitonin from the thyroid gland and parathyroid hormone from the parathyroid glands helps to maintain a constant, stable, regulated level of your blood calcium to avoid these problems from occurring. Move on to the adrenal glands. The adrenal glands are two glands that sit on like a cap on the superior aspects of each kidney. They're triangular in nature, and they consist of two parts. The outer part is called the adrenal cortex, and the inner part is called the adrenal medulla. The adrenal medulla secretes hormones associated with the sympathetic nervous system. The adrenal cortex secretes steroid hormones. Microscopically, if you look from the outside to the center of the adrenal or the medulla, what you see is a fibrous capsule on the outside, and then inside the adrenal cortex is divided up into three regions. Nearest the capsule, the zona glomerulosa, distal to or deep to that, the zona fasciculata, and deep to that, the zona reticularis. That ends the adrenal cortex. Everything deep to that makes up the adrenal medulla, which is made up of specialized cells called chromaffin cells. This is another diagram showing a slide. This is the capsule out here. Here's the adrenal cortex with the zona glomerulosa, this dark area here, the zona fasciculata in here, and then the zona reticularis here, and then the adrenal medulla with the chromaffin cells in here. We're going to talk about the adrenal medulla first, because the adrenal medulla produces primarily two hormones. Those hormones are epinephrine and norepinephrine. Epinephrine and norepinephrine are secreted by the adrenal medulla due to stimulation of the sympathetic nervous system. Again, the system that comes into play if you're being chased by a tiger. And they are both hormones that are amines. They are derived from the amino acid tyrosine. This is norepinephrine and this is epinephrine. And these are released from the adrenal medulla when the sympathetic nervous system is activated. I put on this slide some other substances that are chemically related to these and have some properties similar to those. For example, both of these increase the heart rate. Well, so does amphetamine and methamphetamine, which are abused substances associated with some types of drug addicts. Ephedrine, which is the commonly found substance in Sudafed. Here's pseudoephedrine, also commonly found in Sudafed, are substances all chemically similar to epinephrine and norepinephrine, and they have similar effects in many ways, but obviously some of the illicit substances have more severe effects than these naturally occurring substances. These are natural, these are synthetic substances that we've made similar to those. You can also see the chemical dopamine, which we've talked about when we talked about the nervous system, is also chemically similar to these. So what do epinephrine and norepinephrine do? Well, they have a couple of properties, many properties that are very similar. Normally, the adrenal medulla secretes 80% epinephrine, 20% norepinephrine due to stimulation of the sympathetic nervous system. And they affect many different parts of the body. Both of them increase the heart rate. Both of them increase the force of contraction or the contractility of the heart. So when you're being chased by a tiger, obviously you want your heart to beat harder and push more blood out with each beat, and both epinephrine and norepinephrine do that. The effects on the blood vessels are also similar. Epinephrine causes the skeletal muscle vessels to vasodilate. You want that because if you're being chased by a tiger, you want to increase blood flow to your skeletal muscles. Norepinephrine does the same thing in slightly different way. Systemic blood pressure. There is some increase in blood pressure with epinephrine, but there's a much greater increase with norepinephrine, which is why when people's blood pressures are low, we tend to put people on norepinephrine IV drips to stabilize or maintain their blood pressure, because it has a more effective constriction of the arterioles, which raises blood pressure. Epinephrine and norepinephrine both dilate the airways, but epinephrine does it much more than norepinephrine. This is why when someone has an acute allergic reaction and their airways are closing down or clamping down, the first thing we give them is a shot of epinephrine to dilate their airways so that they can get more air in. The reticular activating system of the brain is that part of the brain associated with wakefulness and sleepiness. Epinephrine activates that. Norepinephrine has little effect. Epinephrine also affects the liver in ways that norepinephrine does not. It promotes the breakdown of glycogen into glucose. Again, if you're being chased by a tiger, you want to release glycogen stores from your liver and release that glucose into the bloodstream so that the cells can use that to make energy to get away from the tiger. This increases your blood glucose level. Norepinephrine doesn't have that much of effect on that. And they both increase your metabolic rate. They both increase the rate in which you produce ATP. The adrenal cortex makes several hormones in the various regions. The most outer region of the cortex, the zona glomerulosa, produces the hormone aldosterone. We've talked about aldosterone before as that hormone that's produced as far as to the renin angiotensin system in response to low blood pressure, and it acts on the kidneys to cause reabsorption of sodium, excretion in the urine of potassium, and reabsorption of water, which is what you're going to want to do if your blood pressure is low. Cortisol is produced largely from the middle region, the zona fasciculata, and it is released in response to adrenocorticotropic hormone, or ACTH, released from the anterior pituitary gland. And then the inner region, the zona reticularis, secretes or produces androgens, testosterone-like hormones that are produced in this region. Here's another diagram of the renin-angiotensin system showing aldosterone. Aldosterone is produced when angiotensin II is produced, and what it does is it then acts to increase sodium reabsorption. Water follows, so you reabsorb sodium from the distal tubule, you reabsorb water, that brings your blood pressure up, and you excrete potassium in the urine because the sodium is exchanged for potassium. This is a diagram we've seen before in the first part showing what's happening at the cellular level. When your blood pressure is low, the renin-angiotensin system kicks in, aldosterone is produced, it floats through the capillaries of the vasa recta, of the peritubular capillaries, and it is then stimulates it because it's a steroid. It can diffuse directly through the cell membrane of the distal tubule, binding to a receptor, which then goes into the nucleus of the cell and changes and produces proteins that are then going to produce channels which are going to allow for sodium reabsorption, potassium excretion. When those channels are activated, the sodium is pulled in, it's exchanged for potassium, so you reabsorb sodium into the bloodstream, you excrete more potassium in the urine, and water follows the sodium into the capillary, so you retain water, which is what you wanted to do because you were dehydrated. A couple of diseases associated with the adrenal cortex. Addison's disease is the absence of aldosterone. If you do not have aldosterone present, then this does not occur, which means if you get dehydrated, you don't have the ability to reabsorb excess sodium and excrete excess potassium, which means that you lose excess sodium in the urine, which means you develop hyponatremia, low sodium levels, and you increase potassium that you're not able to get rid of in your bloodstream, so you end up with hyperkalemia. People who present in extremis with low sodiums, high potassiums, one of the things you have to think of is that they could have Addison's disease. Other associated findings: low blood pressures, abdominal pain, vomiting. This can cause death. It's easily treated with steroid that replaces the aldosterone if it's diagnosed. The opposite is Conn syndrome. Conn syndrome is a syndrome in which your body produces, or your your adrenal cortex produces too much aldosterone. If you have too much aldosterone, then you do this too much, you increase sodium way above what it should. So your sodium levels in the blood go up, your potassium levels go down, so you end up with hypernatremia, high sodiums, hypokalemia, low potassiums. You end up with, because you retain all that water, hypertension, because you have increased fluid volume. That can lead to muscle weakness and ultimately death. Cortisol is a hormone that is produced by the zona fasciculata in the center of the adrenal cortex, and it has several things it does. It decreases protein synthesis and increases the release of fatty acids into the bloodstream. It also stimulates the production of glucose, so your glucose levels go up. It is produced by adrenocorticotropic hormone, which is released from the anterior pituitary gland on stimulation from corticotropin releasing hormone from the hypothalamus. So the hypothalamus produces this. It causes ACTH production, which floats through the bloodstream to the adrenal cortex, which then produces cortisol. Cortisol then affects many different cells in the body, again, stimulating increased glucose production, promoting the release of fatty acids, inhibiting the production of proteins. All of these things are associated with what we're going to talk about it later in this talk about the chronic stress syndrome. Cushing's disease is a condition of too much cortisol. If you have too much cortisol, you end up with all of that fatty acids released being deposited in the tissues. You end up with these areas of fat deposition. You end up with high blood glucose levels. It does affect the brain. The skin appears thin. In males, you may develop gynecomastia, which is the development of breasts in the males, a roundish, what's called the moon face. All of these are things associated with Cushing's disease, or increased cortisol produced by the adrenal cortex. Excuse me. The pancreas. The pancreas is an organ that sits in the abdominal cavity, and it functions as both an exocrine and an endocrine gland. When we talked about the digestive system, we talked about the exocrine pancreas. We talked about that part of the pancreas producing pancreatic juice and bicarbonate and excreting that through a duct into the duodenum, the first part of the small intestine. But the pancreas also has an endocrine gland function where it produces 3 hormones from structures within the pancreas called the pancreatic islet cells, or the islets of Langerhans. The islets of Langerhans, or the pancreatic islets, consists of 3 types of cells: alpha cells that secrete glucagon, beta cells that secrete insulin, and delta cells that secrete somatostatin, which is that same hormone that we had talked about before. When we looked at slides of the pancreas in the past, what we saw were these little round nests of cells. These are the pancreatic islets. The rest of these cells around here are the exocrine pancreas producing pancreatic juice. These are the endocrine cells of the pancreas. Some of these nuclei are alpha cells, some of them are beta cells, some of them are delta cells. Whereas these pancreatic ducts and cells secrete pancreatic juice through a duct into the duodenum, these produce hormones and secrete them into the capillaries and into the bloodstream. The three hormones that are produced in the pancreas, of the three, we're going to talk primarily about glucagon and insulin, because much like parathyroid hormone and calcitonin, glucagon and insulin are both closely related in monitoring and managing blood glucose levels. In other words, these cells that produce these hormones are sensitive to blood glucose levels. When blood glucose levels go up, insulin is secreted, and insulin, as we've already shown, drives glucose from the bloodstream into cells, dropping your blood glucose level down. Glucagon is going to do the opposite. It's going to drive blood glucose levels up when they're low. So these two hormones work in to maintain blood glucose levels in a similar fashion that calcitonin and parathyroid hormone regulates calcium levels. This is a diagram showing how they work. Basically, you have a normal blood glucose level, and then you eat a couple pieces of cake, and your blood glucose level starts to rise as that sugar is absorbed into the bloodstream. And when it starts to rise, the beta cells in your pancreatic islets recognize that. They produce insulin, and insulin promotes the glucose to be taken out of the bloodstream and into certain cells, and promotes the formation of glycogen from glucose as a storage substance in the liver. That brings your blood glucose level back down to normal. If in fact you have a period of fasting and your blood glucose level starts to drop, alpha cells in the pancreatic islets are going to recognize that, and they are going to produce the hormone glucagon. Glucagon is produced by the alpha cells in response to low blood glucose levels, and glucagon basically stimulates the cells of the liver and other parts of the body that store glucose as glycogen to break that down into glucose molecules and empty it into the bloodstream, as well as stimulating cells to take non-carbohydrates and make glucose out of them and dump them into the bloodstream to raise your blood glucose level up to normal. Once your blood glucose levels goes up to normal, then by negative feedback, this is turned off. So if your blood glucose level goes up, insulin is produced by beta cells to bring it down. If your blood glucose level goes down, the alpha cells of your pancreatic islets produce glucagon that brings it up. And that maintains your blood glucose level at a stable state. Another diagram showing the same thing. Here's your pancreas. And basically, if your blood glucose level is high, the pancreas produces insulin, which basically takes glucose into the cells, lowering your blood glucose level down. If your blood glucose level is low, the pancreas secretes glucagon, which tells the liver to take glycogen, which it's stored, break it down into glucose, and spit it out into the bloodstream, raising it back up to normal. Other endocrine glands. The pineal gland. The pineal gland we talked about last semester when we talked about, or earlier in the semester when we talked about structures of the brain. It is a small gland that sits back here, and it is a gland that secretes one hormone. That hormone is called melatonin. Melatonin is referred to as the hormone of darkness. Pineal gland secretions go up when it gets dark. They go down when it gets light. Pineal gland secretions and melatonin is largely involved in regulating your body's circadian rhythms, your day-night cycle. It doesn't make the circadian rhythms. There's another area that does that, but it helps regulate your circadian rhythms. The thymus gland. The thymus gland is a gland that sits within the chest cavity, within the mediastinum. The thymus gland secretes a series of chemical messengers that are called thymosins. Thymosins promote the development of lymphocytes, and they are part of your body's immune system that we'll talk about in a future lecture. The reproductive organs, the testes and the ovaries, as we talked about with the reproductive system, also produce hormones. The ovaries produce estrogen. They produce progesterone. The testes produce testosterone. And then the placenta also produces estrogen, progesterone. And also it produces gonadotropin to maintain the uterine lining so that menses or shedding doesn't occur during pregnancy. Other organs we've already talked about. In the digestive system, we talked about digestive hormones like gastrin, cholecystokinin, secretin. Those are all chemical messengers produced by the digestive glands. We've talked about hormones produced by the heart, beta natriuretic peptide, alpha natriuretic peptide, that are produced in response to overfilling of the heart or high volume on the blood volume that helps to diurese the body and naturally reduce overwhelmed circulatory system. And then the kidneys we've talked about. Today we talked about the production of renin in response to low blood pressure. Also, the kidneys produce the hormone erythropoietin, which is responsible for the production of red blood cells. Finally, we're going to finish off by talking about two ways in which your body responds to stress. Basically, your body's survival, and these are very basic survival effects that are present in many animals to maintain homeostasis and maintain survival. Any change in the external environment can cause stress on the body. Lack of food, too much food, being chased by a tiger, all of those things affect the body and provide and cause stress, which leads to your body reacting to that. Any type of severe stress can trigger a loss of homeostasis, a loss of the ability to control your body's regulation of its bodily functions, and your body reacts to that. For example, as I've said before, anything that causes activation of the sympathetic nervous system causes certain changes in the body. I've used, for example, being chased by a tiger. Here's a man being chased by a tiger. Here's another man being chased by a tiger. This is an Alabama football player being chased by an LSU tiger. In fact, both of these individuals here are under high stress right now. Their sympathetic nervous system is kicking in. So there's two types of stress: physical stress, like this man being chased by a hippopotamus, and psychological stress, you guys studying for tests. Both of these affect the brain. Both of these affect your body's metabolism by certain ways. We talk about two types of stress response. The immediate stress response, which is basically the sympathetic nervous system. That's what this guy is having right now. He's having an immediate response to the sympathetic nervous system, which means that his sympathetic nervous system has kicked in. It is doing all the things the sympathetic nervous system does. It's going to release norepinephrine at the sympathetic nerve endings. It's going to increase heart rate. It's going to increase blood pressure. In addition, when your sympathetic nervous system